What up, peeps? Welcome to the Podcast. I'm your host, John Telewa, aka the Kissbandit. And in this show, we explore the key elements that shape our fulfilling existence, from health and well-being to financial success, meaningful relationships, and the pursuit of happiness. We cover it all. Our guests include experts, professionals, and everyday individuals who have remarkable stories to tell. Tune in to learn practical tips, gain valuable insights, and discover strategies for personal growth and transformation. Whether you're seeking to improve your health, build your wealth, enhance relationships, or find lasting happiness, we got you covered. Welcome to today's episode. So another amazing episode with a very special guest. This one is very special to me as well because, I have a personal story from it. So thank you very much for coming to the show. But before we start off with anything, because I know you have a lot of things to do and you're a very busy person, let's just start with your name and what you do, and then I'll take it from there with my questions. And when you see me on my phone, it's because I need this referral notes, right?
Sure.
Okay.
Thank you so much, John. So for audience, my name is Dr. Dhaval Mistry. I am a consultant general surgeon with a special interest in laparoscopic surgeries and gastrointestinal surgeries. So I have experience of more than 11 years after completing my surgical training, and I've been in Kenya for last 6 years. So my area of focus is laparoscopic surgeries, right from basic surgeries from removal of appendix, gallbladder, to intermediate surgeries like repair of hernias and anti-reflux surgeries for acid reflux. And I also do advanced surgeries like gastrointestinal cancers and obesity surgeries via laparoscopy.
Okay, that's a very good. Nobody has ever done like such an introduction of themselves like that, but that's a really nice brief way of just generalizing everything like into like one paragraph probably. Okay, now just jumping straight to it, just a background history, like what just made you interested? Is that something that you had interest in like from as a kid, or it's just something that developed on later?
I myself got operated for an inflamed appendix when I was in school. So when I was hospitalized, I saw the surgeons coming in, operating on me, and it looked very glorious career to me. And that made me think that it's a nice career to pursue. And I looked into it, studied a bit. I have got good marks, so I got into the medical school. And surgery always fascinated me. Now, you see, when you entered in a medical school, there are various options to go into. Like there is different field in medicines. Like there are physicians, there is neurology, there is gynecology, then there are the surgeons. So surgical field always attracted me, partially because I myself underwent a surgery. I saw the surgeons operating on me, and that's how I ended up being a surgeon.
Very nice. And then now, like when it comes to like studies as well, there's like just on your Instagram bio, something to do with the French, what is it called? French something.
French.
No. Let me just get it right. Again, I say like most of the things that I might not get like correctly, but I stand to be corrected. Okay, let me start with, you have qualifications with MBBS, MS, FRCS, FMAS, and then FIAGES,
and Diploma University, France.
Oh, I think that's what I was saying. Diploma University in France.
Yeah.
So like just in a nutshell, is there like a qualification where do you have to go and study somewhere overseas for to be certified for something specific?
Yes, like my basic education was done in India. This MBBS is the basic medical degree, equivalent to MBCHB here in Kenya.
Okay.
After that, this MS is our surgical training that was also done in India. But then for some advanced things like advanced laparoscopy, like these obesity surgeries, laparoscopic surgeries, which are keyhole surgeries for gastrointestinal cancers, I went to France to learn those surgeries. So at the end of course, they take an examination and award us a diploma that we are trained in it. So that one is for that one. Diploma University from France. And FRCS is the Fellow of the Royal College for Surgeons from England.
Okay. So you also have to go and study that from England, or
No, once you are experienced, I mean, there are two options. So if you go there and study for 6 years over, then you can clear the exam. But once you already have some experience, you can just appear for exam and get that degree as well, which enables you to practice in UK as well.
Oh, okay, perfect. So now you see, the France thing was just not me throwing a word like out from nowhere. So it actually makes a lot of sense. And then is it like a big challenge transforming from like just general surgery to now getting into it's
laparoscopic?
Because now we're talking about cameras being involved and high-end technology.
Yes.
Is it like a difficult bridge to get into?
Yes, I mean, as long as you don't know it, it's always difficult. But once you practice it, as you get experience, it's like everything. Like it doesn't become difficult later on. So initially, it is difficult because it demands a high learning curve. So you need to perform certain number of hours on the endotrainers. Then you spend sometimes in assisting senior surgeons. You gain more experience and then you become an independent surgeon. So it's a stepwise process. So initially you always find it difficult. And once you achieve all the steps, then I don't think it's any more difficult. But cost-wise also initially when you're a freshly passed out surgeon, these things may be a bit expensive. But over the long run, it pays off.
It's definitely worth it, right?
Yes.
And then if you're just to describe the surgery in layman's terms, because like, you know, like even for my case personally, I was just afraid of surgery in general. And it's crazy because even for you, say like your first surgery was appendix, and I actually also got like appendictriotomy, I think. Appendectomy, like when I was like back in class 3 or class 4. But if you're just to describe it in a nutshell for people who are probably old school or are not used to like modern terms, like how would you describe it?
Surgery.
The laparoscopic surgery. Yes.
Now, see, the traditional surgery entails big cuts, opening up your tummy and then doing the surgery. So because of those big cuts, there is significant amount of pain after surgery. There is slower recovery. Someone may not be able to get out of bed very fast. But laparoscopic surgery in simple terminology are keyhole surgeries. So we make small holes which are size of a keyhole. Through those keyholes, we put cameras inside. We can see whatever is inside on a TV screen. Then other keyholes, we put some instruments, and under that television guidance, we move our instruments inside your body and we can perform a surgery. So basically the cuts are very small, so pain is significantly less compared to the traditional surgeries. The chances of bleeding, infections are much less, and the recovery is much faster.
Okay, especially for the recovery bit, I think that's where a lot of people fear, because especially if you're an adult, you have other duties to perform, probably a job to go to.
True.
Like if you have kids and a wife, you still have to attend to them, so it actually makes perfect sense.
Yes.
Okay, and then like, what would you say like are just general misconceptions that people have about laparoscopic surgery?
Misconception wise, I would say they think that laparoscopy is way expensive. That's the most common misconception.
Definitely.
True. It's a little bit expensive than the traditional surgeries, but I would say it's not very expensive unless the higher end surgeries. But the most common surgeries like a hernia repair or an anti-reflux surgeries, gallbladder removal or appendicectomy, if you see the overall cost, usually laparoscopic surgery are more cost effective because you see, once you go for an open surgery, you need to spend about 2 to 3 days in the hospital. So your hospital stay is longer. So that adds up on your bill. You stay from your work for significantly longer time. So that affects you in terms of your income. When you do a laparoscopic surgery, you may be discharged the same evening or maybe the next morning. So your hospital stay is shorter. So you cut down on your hospital stay, those medications. You can return to your work faster. So your income doesn't get compromised. So if you compare those things, eventually the laparoscopic surgeries are more cost effective.
You're getting your money's worth, if you were to put it in that way, right? Okay, and then just... I know you've said like a typical timeline. but as long it's not that invasive, right?
Yeah, it's not invasive.
But what's the typical timeline? Like, would you say 1 week, 2-3 days before you're just like, I don't know again.
It always depends upon the surgery. Like simple surgeries like appendectomy, cholecystectomy, young patients like you, we may do the surgery in the morning, discharge you by the evening. Okay, some intermediate surgeries, you may need to stay 1 or 2 nights after the hospital, like bariatric surgeries, the weight loss surgeries.
Yeah.
Right now we prefer to keep you 2 nights in the hospital because patients are not very well convinced that I'm undergoing a major surgery and still have to go home very fast. But as we gain more experience, we tend to reduce it to 1 night and eventually as a daycare surgery. In Europe and America, the centers which have more experience, they are still discharging patients in the evening.
Same day?
Same day, even after those major surgeries. But we are yet to gain that experience to have high volumes here. But yeah, if you do a cancer surgery, maybe 3 or 4 nights after surgery, even after laparoscopy. But those surgeries, if you go for an open surgery, you may end up in hospital for 1 week to 2 weeks as well.
Okay. And is this determined by the technology that they're using or just their way advancing, like the hours they've performed the procedures?
There are multiple factors.
Okay.
It depends upon how much time you're spending in the operation theater. It also depends your age, your comorbidities. You should not be having any other diseases like lung issue, heart issue. So those factors also plays a part. How severe your disease is, like appendectomy. 98% of time it's a simple surgery. But the 2% cases when it's too difficult, infection is too much, you might have to spend 2-3 nights as well. So it's a multifactorial thing. But if you see majority, I would say about 95 to 98%, on average, it's very fast recovery.
Okay, this is just like maybe off my notes, but I also just want to get into a doctor's mind. Does it ever get normal, just like, opening up people and seeing like just body parts? And I'm just talking as a, because I was almost like, I was asking the nurses, like, is it too late for me to change my mind? But does it just get normal at some point for a doctor to just see like, different body parts and operating when you're seeing blood and everything? Because I haven't had like actually a surgeon on my podcast.
As in, I don't exactly get this question.
So does it get normal for you to just deal with blood? And just in general? Because that's, and you see, even when I'm asking, just you don't even understand it because it's like, that's already like just second nature to you.
Yeah, kind of.
But
like
to
sometimes
us, patients, it's completely different.
Yeah, for me, it's my day-to-day job. I see the blood every day. So now it's a routine for me, and I don't see any difference. Like it's subconsciously, I'll just go in and do the surgeries. But yeah, as a patient, it's something big for you. I mean, you've never undergone a surgery. So your perspective is a lot different from my perspective. So sometimes it also happens, like a patient would feel that this doctor is taking it lightly or he's not worried a lot. I mean, as a patient, it's first time for you. You're undergoing a cut. I'm not undergoing a cut. I'm the one putting a cut. But so that gives you a lot of anxiety. And you don't see any anxiety on my part. I am completely relaxed. So that also happens sometimes, that it's our second nature. We are used to it.
Okay, makes sense. And then, like, how do you determine whether a patient is a suitable candidate for the laparoscopic surgery?
Almost always, all the patients can be suitable for laparoscopic surgery, except there are specific contraindications. Like when we want to do laparoscopy, we put a lot of gas in your tummy, like carbon dioxide. So if someone is having heart issue or lung issue, it may affect them. So if your cardiopulmonary reserve is compromised, you may not be able to undergo laparoscopic surgery. It also depends upon disease severity, like some cancers, if they have been too extensive, if they have spread to multiple organs, sometimes laparoscopy could be difficult. But otherwise, most of the patients, they are suitable candidate for laparoscopy as long as they don't have such contraindications.
Like underlying conditions.
Underlying conditions.
That makes sense. Okay, so now let's just touch on the weight loss surgery, because this is something that also, like, on mainstream right now, it's almost, I can just say it's very popular, because 1 month you see somebody seems like they're almost like obese, and then after a couple of months, they definitely see like a gradual change as compared to back in the day. So bariatric surgery, if you were to break it down and just describe it to a layman, how would you describe it?
Now, see, first thing, I want to make a clear difference between cosmetic surgery and bariatric surgery.
Okay.
These two are different things. So the cosmetic surgeries are usually done by plastic surgeons. Bariatric surgeries are done by laparoscopic surgeons.
Okay.
Now, for cosmetic surgeries, what they usually do is liposuction, tummy tuck, excessive skin reduction, those things. So they only work on a specific part of your body. So it's called a thing called spot reduction.
Okay.
Like if you want to remove only the tummy fat, you're fine with your overall appearance, then you go for a cosmetic surgery by a plastic surgeon. These are not life-saving surgeries. Okay, these are done to look better.
Purely cosmetic.
Cosmetic. Yeah. The bariatric surgeries are not cosmetic surgeries. They are life-improving surgeries. Okay, so what we do is we reduce the size of your stomach, or sometimes we bypass the intestines to make metabolic changes in your body. So that's why these are also called metabolic surgeries. So it helps reduce fat from all over the body. So even your cheeks, your neck, your tummy, thighs, hips, even the internal fat, the fat around your liver, intestines, which is called visceral fat. That also reduces with these bariatric surgeries. So when you get reduction of all this fat, it also helps your joints to bear less pressure on them. It improves your cardiopulmonary function. Your heart and lung doesn't have to work a lot to carry to make you move. So this improves your lifestyle. And statistically, it also reduces risk of cancer when you have less fat. So this is done to improve your quality of life, to increase your life expectancy. So these two are different things. Now here, there is no spot reduction. If you ask me that I specifically want to reduce my tummy, bariatric surgery wouldn't have. Then you better go for a cosmetic. But yeah, if you want to improve your lifestyle because of excess weight, if you want to lose overall fat, this surgery are very helpful.
What's the success rate in bariatric surgery? Is it like, are there some places where people can get complications, or is it just the success rate is always...
Success is a bit different from complications. Like success, we measure in terms of your weight loss and reduction of comorbidities. Okay. So I would say success rate is about 90 to 95%.
Wow.
Yeah, we do get 5 to 10% of patients who may not lose enough weight, or they may regain weight even after the surgery over the next 2-3 years. So that can happen with 5 to 10%, but that is again a multifactorial thing. Like it can be from our side that surgery is not done very nicely. It can be on patient side that they don't stick to the diet plan, they don't do exercises, or our biggest enemy, alcohol. If the patients go back to alcohol or a lot of sugary foods, a lot of these fast foods, you may regain the weight. So success rate, we achieve in 90 to 95% of patients. Complications are a different thing. Complications, you may sometimes get some bleeding inside your tummy. Sometimes you may get some leaks. But the rates of these complications are around 2%.
Okay.
I would
Very
say,
rare.
Yeah. So, but yeah, when you do about 100, 150 cases, you may get 2 or 3 patients who may get some complications. But we do manage them. Okay. It's extremely rare to lose someone because of this surgery. But overall, they are safe surgeries.
Okay. And then another question, and it might come off like as a silly question, but trust me, just Kenya in general, people say Kenya is a drinking nation, because like that's the one entertainment thing that everybody, like not everybody, sorry, like a lot of people definitely engage in during the weekend. How does alcohol like factor, just like affect this weight process thing?
Now, that reminds me, same answer which I have got from multiple patients. Like when a patient comes in to our clinic and when we take their history, I ask whether do you drink, and
Yes.
many times I got an answer, I am a Kenyan. So that implies that I am drinking
Automatically, yeah.
yeah.
Mhm.
So it's taken as a proud, but it affects your overall health. Now, alcohol gets absorbed very fast from your body. I mean, from your stomach, and it enters your body very fast. Also, alcohol doesn't have any nutrients. It's an empty calories. So those empty calories get converted into fat and it gets accumulated in your body.
Okay.
Other effects of alcohol is it irritates your stomach. It can give you gastritis. It irritates your food pipe. It can give you acid reflux issue. It affects your liver and pancreas. Someone can lead to liver failure if they drink a lot of time. It can lead to pancreatitis, and it can also lead to some cancers, gastrointestinal cancers, even breast cancers. They can be caused by alcohol. So it's always best to stay away from alcohol. But even if you can't stay away, it should be occasional. Like it
Just
should not
minimize it.
Minimize it.
Oh, okay, interesting. Because I think that's also like one of the questions you asked me when I was coming for consultation. And it's funny enough because off my notes again, when I bumped into you into Westgate, I don't know whether you noticed what I was carrying.
No, I didn't know.
Because it hit me now later on when I'm getting into the car. It's like, I told him I don't drink, but what I'm carrying was alcohol, but not alcohol for drinking. It was like wine rice that can only be bought like at that specific location. So I was just like, oh, maybe now he'll just start thinking that, But then again, I have to tap into, remember like, oh, this is a doctor. He deals with so many different interesting cases. He's probably not even paying attention to that. But that was just me like now just wondering like, oh, what is even thinking about me? Okay, now another thing about like just weight loss. Another thing that's very popularized currently is Ozempic.
Yes.
So now I don't know if you have any opinions on that personally, because you deal with like now bariatric surgery, and other people are leaning towards. In fact, on mainstream a lot, what people know is Ozempic.
Yeah.
So what's your opinion on that?
I'm a bit neutral about Ozempic. Like if you want to try it, definitely it can be tried. Now, it always depends upon what your personal goals are. Like someone doesn't want to undergo a surgery. They want minimal invasive things. So for them, Ozempic would work well. Now, statistically, if you see, Ozempic gives you weight loss about 10 to 15% of your body weight. Okay. So if you're a 100 kg guy, you may lose about 10 to 15 kg of weight. If that is your goal, perfectly fine. You can go with Ozempic. Okay. But if your goal is to come into your 70s, if you want to lose 30-40% of your body weight, that's not going to get achieved with Ozempic. For that, you need bariatric surgeries. Like with sleeve gastrectomy, you may lose about 30% of your body weight. On average, some people may go up to 40% also. With gastric bypasses, you lose about 40% of your body weight. So it always depends upon your goal, your other comorbidities like correction of your diabetes, reflux issue. Those things would be better with a gastric bypass rather than Ozempic. Ozempic also has these side effects like gastrointestinal disturbance. So there are a lot of people who would not be able to stick with Ozempic more than 2-3 months. Eventually they get fed up and they can't continue it anymore. But you need to take them for at least a year to see those results. Another thing is it's a new thing, like it's been in American market for last 6-7 years as obesity medicines, and in Kenya it's only there for last around 2 years. And so we don't know the long-term effects. But yeah, that's how you get to know about all the medicines. So it's okay. If someone's goal is about 10-15% of weight loss, they don't want to undergo any procedure, I would say, yes, Ozempic can be fine for you.
Okay, so definitely bariatric surgery is more effective when you're trying to actually...
Yes, not just for the effective for weight loss, also cost effective, I would say.
Oh, really?
Yeah.
Okay, I've heard Ozempic is expensive, right?
Yeah, it's expensive. Like if you see your 1 year Ozempic dose, it becomes as good as a bariatric surgery or maybe a little bit more than that.
Yeah.
I would say 10% here and there. But amount of weight loss and the relief from comorbidities that you get from bariatric surgery is much more compared to Ozempic. So that is why I consider bariatric surgery is more cost effective.
Okay.
But again, it's always a personal choice. So we don't force anyone about it.
And then just another one to finalize on that, because again, I also have just to touch on Ozempic, because trust me, on TikTok and Instagram, it's all over the place, even on YouTube. Does this mean if, let's say, you've done it for like 6 months, and then let's say you run out of a budget of just making sure you buy the meds consistently, will that mean like your weight loss journey is affected and you might start gaining back weight? I don't know.
Now, it's hard to believe that you run out of money, because we always be clear that this is the cost. So unless you have that budget, don't start on it. So it's always better to ask your doctor that what will be the total cost over the long run. Okay, you should not end up midway.
True.
Yeah, but you may have some weight loss in 6 months, but it won't be desired weight loss. And if you stop, chances of regain will always be there. But we are yet to see long-term results, like what happens after 1 or 2 years, whether you regain or no. For bariatric surgeries, it's been there for 60, 70 years. Laparoscopic bariatric surgery.
60, 70 years?
Yeah. Laparoscopic surgeries, they've been there for more than 35 years. I mean, around 35 years. It's been there. So we know the long-term results, the failure rate. That's why I'm saying we have about 10% patients who regain weight in the long run. For Ozempic, we don't know the exact data.
Okay, that's actually interesting. And, it's always good to know like just extra information before you get yourself into like such a situation. Okay, and then also like just for bariatric surgery, right? Like what are some of like just even the myths and fears around it?
First fear
that you've heard from, like, let's say patients when they're coming, this is like their major concern.
Yeah, most major concern, everybody thinks whether I'll survive this surgery or not. But you will definitely survive the surgery. The other major concerns for them are they are fearing that they won't be able to eat a lot. They fear about the complications of these surgeries, like bleeding, the leaks, food leaking out in your tummy. They are worried about it because everybody do some Googling and then they come to the clinic.
The worst thing,
so they have a lot of fear regarding this. So all we do is counsel them. We show them statistics that these are the statistics. It doesn't happen with everyone. Although we don't know which category you're going to fall in. But statistically, chances are minimal.
Okay. And then another thing is what lifestyle changes do the patients need to like actually incorporate in their life after such a procedure? Because it's also,
that's the most important thing. Well, I always tell the patients that surgery is only the half part. Okay, the remaining half part is after surgery care.
Okay,
like it's not like that once we have done surgery, everything is done and now you can go on eat everything. You need to be good at your choices. You need to be eating a lot of protein rich food, less of refined sugars and less fats, more fibers.
Okay.
So we give a typical diet plan for up to 6 months. You need to stay away from all the sugary desserts, sodas, alcohol. And you also need to do some weight trainings, like you need to build up your muscles. Now when we do surgery, naturally along with fat, body will burn a bit of muscles as well. We don't want that. We want you to preserve your muscles.
Okay.
So you need to eat this protein rich food and do some strength training. So it not only reduces you in size, it also changes your shape and your overall strength and health.
And does it matter like if your protein intake is plant-based or like animal-based?
That doesn't matter. I mean,
really?
Animal-based protein is also fine. It's a personal choice. Some people are vegan, so they would like plant-based proteins. If you are a carnivore and if you want animal-based protein, that's completely fine. But the thing is, when you take animal-based protein, it itself has a bit of fat inside your protein. So it's always good to make a right choice. That don't go for fried meats. Better go for roasted or boiled meats, shallow fried, something like that. Not deep fried chicken to get your protein.
Okay. And then like now another just topic on the appendectomy.
Yes.
Just if you were to break it down briefly, because it's just also something that I've never understood, because like even for my case, I got it when I was very, very young.
Yeah.
So what could be like the major cause? Maybe is it lifestyle? Is it genetics? Or where does it come from? Where does it stem from?
Now, see, it's poorly understood what exactly causes this appendicitis, that is inflammation of your appendix, but most of the times it's a form of infection. Now, appendix is a vestigial organ. Vestigial organ means that our ancestors needed it for digestion, but in today's era, we don't need that organ for digestion. So it has reduced in size significantly. It lies in right lower part of your tummy. Not having much functions, although a recent study suggests that it do have some immune function. It helps us in some form of immunity, but not yet very well established. There is partial evidence that it may play a part in your immunity, but because of some infections, it can get inflamed. When it gets inflamed, it gives you a lot of pain. It can lead to sepsis, and if not treated, it can burst, which can lead to severe sepsis and shock as well. That is why whenever an appendix gets inflamed, it needs to be removed out so that you prevent that sepsis.
But now, like also with something like that, especially let's just try and imagine people who are in upcountry.
Yeah.
How easy, like, or like how can like even just parents detect that, like on children or teenagers? Or even like some adults might not really pay attention to. They just think like it's a stomachache, take painkillers. You know, it's not easy for everybody to just walk in hospital and admit they have like actually a problem. But what should be concerning to people before they?
First thing it will give is the severe pain. Initially, it starts with central part of your tummy, and then it moves to the right side. So that gives an idea that this could be an appendicitis. It can be associated with vomiting, fever, those things. So if pain is associated with other symptoms like vomiting, fever, diarrhea, always go to hospital as soon as possible, seek a doctor so they can run your basic test and they can find out if it is appendicitis or no. Now, it used to happen in past, but in today's era, we have seen very less cases that when the appendicitis has been missed. So it used to happen around 20 years back.
Yeah.
But today, the availability of this blood test, ultrasound machine is also very common even in upcountry.
So even a blood test can actually detect and show you?
Blood test will give you an idea. If you have pain in right lower tummy and it's associated with raise in the infection counts on the blood test, we assume that it should be appendicitis. And ultrasound nowadays is widely available. Now, although the better test for it is a CT scan, which is available in most of the big cities. It may not be available in upcountry, but basic ultrasound, nowadays it's available most of the places.
You've mentioned ultrasound, and again, this is coming from a layman's perspective, right?
Yeah.
When you mention ultrasound, I just know it as a pregnancy scan.
Okay.
That's all I know. But what else is involved, or how else is it used to?
Ultrasound is just a scan, which has a probe which you put on your tummy or the area where you want to see the things.
Yeah.
It will send ultrasound waves that gets reflect to the probe. And because of that reflection, there is difference in reflection. You will see a black and white picture on the TV.
Of like actually the organs.
So it's not just about the pregnancy and to see the baby. It can see your other organs like liver, kidneys, everything.
Okay, and then let's jump again to anti-reflux surgery now.
Yes.
If you were to break that down to like just, again, a layman, what would that be?
Now, see, anti-reflux surgery is done to treat this acid reflux. Now, what does acid reflux means? We have this food pipe in our chest area, then in the tummy comes our stomach, which stores the food. Then eventually that food passes into the intestines.
Yeah.
Now, junction between our food pipe and stomach, it has a valve, which is tight and prevents the food and acid to come back up. Okay. But due to our modern lifestyle, our dietary habits, we do some silly things like eating a lot of fried food, drinking soda, alcohol, smoking, chocolates, spicy foods. This will make that valve loose. When that valve is loose, it lets the food and acid to come back up. So when the food and acid comes back up, you feel those heartburns. If it comes to your throat, you may feel throat irritation. Sometimes you get some cough. If it comes to your mouth, you get bitter or sourness in your mouth. It may have some atypical symptoms like having asthma-like symptoms for a very long time. So it affects your quality of life. And there is a slight increase in cancer risk because of continuous exposure of acid to your food pipe.
Wow.
Okay. Not too much, but a bit.
Yeah.
So it needs treatment. So treatment entails diet first because it happens because of your diet. So you need to cut down on smoking, alcohol, sodas, fried food, spicy food, coffees, chocolates.
Yeah.
Even after doing diet changes, if it doesn't help, there are those medicines which reduces acidity, which increases stomach motility so that food passes into the intestines faster. There are a significant number of people who do not benefit from diet or even the medicines. In those patients, they need surgery. We need to make that valve tight. So usually we wrap their own stomach around the food pipe and make it tight. So
use their own stomach?
Yeah,
Okay.
Patient's own stomach. Stomach is a stretchable organ. So the stretching part, we wrap it around the food pipe. It's called a fundoplication. But that makes the valve tight and it prevents the food and acid to come back up. Again, with laparoscopy, so no big cut. So it's a pretty much safe surgery.
See, everything is just a bit mind-blowing for me. So I just excuse the shock value as well. And then also just on that, because I know I have other questions and I'm trying to make sure I stick within the hour because I know you have you have other important things to attend to. Okay. So how soon does a patient actually need that procedure done? If let's say maybe they've detected the acidity for probably, is it a month, a year? After how long should they actually now consider surgery as a priority?
Now, see, it always depends upon your symptoms. If your symptoms are getting better with just diet changes or maybe medicines, you don't need surgery at all.
Yeah.
Then you don't need to go for it. Yeah. If you're not getting better with surgeries, if you're not getting better with diet and medicines, then obviously you need a surgery. But when to do it, it also depends upon the other changes. Like when we do an endoscopy, if we see a lot of changes or damage in the food pipe, then surgery needs to be done as soon as possible. If you don't have those changes in the food pipe, that it has not damaged it yet, then it's not an emergency. You can plan it out, like during your vacation, or if you have some leaves piling up, you can use them.
Yeah.
So you can wait a bit. It's not like that you need to do today or tomorrow. It's not that.
So you can just actually give it a little bit of time before you jump into it.
If you have those danger signs in food pipe that it has already started damaging the food pipe, then maybe you need to go as soon as possible.
Prioritize on that.
Yeah.
Okay. What's the post-surgery care for this as well?
Yeah, so post-surgery, when we make their food pipe tight, initially it is more tight because it was loose and suddenly it's tight.
Yeah.
So there is a significant difference for yourself. So you may not be able to take solid foods immediately after surgery. So we need to start with liquids first diet. As you tolerate liquids well, we add some soft diet like mashed potatoes, rice, something like that. As you tolerate it better, you go on to other hard stuff. For meat and all, we first start with fish because it's the softest form of meat. Then you go for chicken and steaks, and those things will be the last thing. So we gradually progress as you tolerate it.
Interesting. Okay. So now let's jump into hernia repair because that's also something that you've specialized in. So how would you again just describe it in layman's terms? Because I think the craziest part is just your ordinary person just walking the street. They just do not know the definitions of things that they might be going through or they can even relate to.
Yeah. So see, hernia is a basically defect in a muscle of your body. Okay. Most commonly, the abdominal muscles. You see, we have these abs and obliques, which keeps our intestines and the fat around intestines in place. It just doesn't come out by its way.
Yeah.
So there can be some defects in the muscles through which the contents inside, they may try to come out. So the most common sites for this defect are the groins for males, and these navel area, or the area where you have undergone a surgery before. So when you have a defect there, the intestines or maybe the fat or the internal contents would just pop it out. So you may see a bulge. But when you lie down, it may fall back because of gravity. So that's a hernia. Now, there is no medication which can repair the muscle defects. You need to repair it via surgery. So you need to close the muscle defects by suturing it.
Yeah.
And for adult patients, you need to cover that defect area with a thing called mesh. It's a net-like material which will strengthen your muscles so that chances of hernia coming back are minimal.
Okay. And then does that, say we call it a mesh?
Yeah.
Is it something that dissolves, or it still remains like permanently in your system to just control it?
There are dissolvable meshes, but it has specific indications. Like if you go for a surgery in emergency, something like that. But if it dissolves, the strength is lost. So we need non-absorbable meshes. So it needs to stay there forever. But there are these inert materials which doesn't create much reaction with your body. Although we need some reaction in your body for mesh to get adjusted, but there are these specific materials which doesn't create much complications.
Okay. And then like now, are there maybe like lifestyle or occupational factors that actually cause
hernia?
Hernia.
Yeah, there are lifestyle factors like smoking and alcohol. They can make your muscles weak. So more so smoking than alcohol. So it can be seen more in the smokers. Obesity. So if you are obese, that also, see, when we have this fat, it accumulates everywhere. So it can go between your muscles. So when your muscles start getting some fat, your muscles become weak. And then it can have some defects.
Yeah.
So smoking, obesity, doing activities which can put a lot of pressure on your tummy. So heavy weightlifters can get a hernia if exercises are not done properly. Or some things like natural diseases, like a lot of cough, constipation, if you have to press a lot to pass urine, or sometimes pregnancy itself can bring hernia.
Interesting. And then also, like, even just on occupational, what about people who are doing things like construction? We see them like some of the healthiest people. So does this...
Because they have to lift heavy things
every day.
Yeah, when you're hammering, you put a lot of pressure on your tummy. So these things can bring it.
Oh, wow. So you see, like, at times it could be like the healthiest person, even like probably a bodybuilder or somebody with a very healthy lifestyle. Yeah. But these can actually...
They can still have it.
Wow. Okay. So, can someone still go back to... let's say they've already been accustomed to like the kind of work that they're doing, which involves heavy lifting.
Yes.
After the procedure, can they go back to that?
Yeah, but not immediately. We advise not to go for the similar kind of work for at least 1 month, because that is the time needed for your wounds to heal and mesh to get adjusted around that area. If you go for that heavy work immediately, it can create this tension in the tissues. The hernia site may open up again. So after surgery, for at least 1 month, no heavy exercises, no gymming. So we ask them to take a rest. We give them later that you should be staying away from heavy work at least for a month. But over the time, gradually, you can go back to your work. That's the basic purpose of mesh, that you should be able to do these things.
Okay. So gradually after a while, you can... Okay. Then just not go all the way out and start doing extremes.
Slowly and then gradually increase.
Okay. Perfect. And then now definitely... to wind up on the topics, we definitely have to touch to a personal experience.
Yes.
So anal fissures and hemorrhoids.
Yeah.
And, just layman's terms again, if you're to describe these two, how would you describe them to layman's?
Actually, there are 3 things which affect an anus. So,
what's sinuses?
No, fistulas.
Okay.
Fissure, fistulas, and hemorrhoids. There are 3 things which affect
fissures,
fistulas, and hemorrhoids.
Okay.
There are 3 things that affects anus. All 3 comes because of constipation. Okay. So a fissure is a cut at your anus, which happens because of hard stools. And
Yeah.
that cut typically gives a lot of pain and minimal bleeding. Okay. Fistula is an abnormal communication between your anus and the external skin. So it creates a small tract between these two things, and it gives you pus discharge around your anus. And hemorrhoids are the dilated or maybe swollen blood vessels inside your anus, which typically gives you bleeding but minimal pain. So these are the three things: more pain, less bleeding, it's a fissure; more bleeding, less pain, it's an hemorrhoid; and pus, it's usually a fistula. But basic cause for all these three things is our lifestyle and constipation. So if you don't drink enough water, if you don't eat enough fibers, and if you're not active enough, if you have sedentary lifestyles, you may get these things. There are some other medical conditions also, like for constipations, like if you have thyroid issue, diabetes issue, some electrolyte abnormalities, you can still get constipation. But the most common causes is our diet and lifestyle.
Okay, and then this is just me throwing it out there and just asking randomly, you know, as a layman. Is there any way that this could be like just affected on someone because of like maybe genetics, or it just comes naturally? Are there chances that that can just happen naturally, or like maybe genetics, or you know?
See, there is no evidence that it's genetic. Okay. But why you see more common in a families, usually families will eat same diet. So when you guys are eating same things, more people in a family can get the same things. But exactly, it's not a genetic thing.
Okay, so most likely, definitely food and lifestyle.
Yes.
And then, like, a follow-up question on that: would that mean that if somebody is doing like an 8 to 5 job where they're seated on their desk, probably, which is like a huge population of people who normally check in 8 in the morning and they sat on the desk probably till evening?
Yes.
Can that be like also like a major?
Yeah, that can be a major issue. But see, again, it's your choices. You're still having time from 5 to 8 in the morning. You can be active in that time.
True.
You can have enough fibers during that time. But yeah, it's not advisable to sit continuously 8 to 5 on desk. Even if you're working, you can obviously stand a bit, have a short walk for maybe 1 or 2 minutes every 15-20 minutes, and come back to your chair. I don't think any supervisor wouldn't allow you that. You can just have a small walk for 1 or 2 minutes every 15-20 minutes, and which should also help. If you stay stationary for very long, then it will definitely affect you.
The main reason, like, I've brought this up also, it's because I'm just trying to think, like, in normal circumstances, if somebody's like in primary school, it does involve you like sitting down for like a very long durations of time.
Yes.
High school, probably the same. And then you get into the job market. Also, again, like, yes, you can take like a few minutes to exercise, but I think once you get past like high school, probably people slow down on like exercising a lot and putting into consideration things like fiber, hydrating.
Yes.
Actually, and even to mention on that, I remember like when I did my Euro trip, I remember there's this lady who kept on getting headaches. And then I kept on telling her, like, yo, I don't think I've seen you drinking water like the entire trip. And she just said she's not a fan of water. And basically she says, I asked her, if you're thirsty, what do you do? She said she drinks soda.
Oh, I would say it's a poor choice. I mean, water is the best drink, I would say. Soda brings along a lot of carbon dioxide, acids, and a lot of sugar. So this high sugar and no fibers at all. So it's not going to help you. So eventually you end up having these headaches and other things like gastrointestinal disturbances, obesity.
And long term, it's just not good.
Yeah, not at all.
Okay. And then like when is surgery necessary for just the fissure, fistula, and hemorrhoids? Like when do you think like now is like, okay, the perfect time to, okay, not the perfect time, like the necessary time to get it? Because maybe you're trying your remedies and everything. Yeah.
So fissure and hemorrhoids, they can always be treated with diet and medicines as well. So we usually starts with dietary changes, drink more water, eat more fibers, all these things. There are medications to treat fissure and hemorrhoids. When the medications also fail for approximately about, if you have tried medicines for 4 to 6 weeks and still not helping at all, or in case of fissure, the pain is excruciating that you can't even tolerate to sit. Those cases, you obviously need to go for surgery. So that's the thing. For fistula, surgery is almost always needed because it's a track. It's an anatomical defect which doesn't close by itself with any medication. So fistula, almost always you need a surgery. But fissure and hemorrhoids, we do it when medical management fails.
Okay, and then like just things like hemorrhoids and also let's say fissure. Is there any chance they can just go away on their own? Like let's just start maybe with hemorrhoids because they are more, how would you say it? Like the things that have grown like kind of like, is there any chance that they can go away?
Like fissure can go away by itself if you take care of your diet. Fissure is a cut. A cut can heal and it will go away. Okay, but it can always come back again if you are not careful with your diet. Okay. Hemorrhoids, early stages. If you start taking care of your diet, take some medicines, it can go away at early stages. But if it's intermediate or late stages, less likely to go away completely. But as long as they don't give you any bleeding, you can just let it be. Not all the hemorrhoids needs to be operated unless they are giving you any symptoms.
Okay.
So that's fine. Fistula, they never go away by its own.
Oh, so that just definitely needs a procedure. Okay. Why do you think many people delay treatment for rectal issues? And what would you say for someone feeling embarrassed to seek help? That's definitely me, first of all.
First thing is embarrassment. You are shy away to talk about private parts, anal parts. So you wouldn't even tell anyone. That's why people come to doctors very late, especially females. Because if you see, still, the majority of doctors are male. I mean, we do need more female doctors. But when you're a female and if you have to go to a male doctor, you won't be comfortable to get examined like that. So that embarrassment is the major cause that people delay their treatment. After the treatment also, there is more fear getting cut at your anal area. You'll always have more fear to get a cut. I mean, rather than having a cut you'll prefer a cut on a hand over the anal area. So because of all these things, because there is a cultural taboo with that area, and that makes people delay their treatment.
Okay. Now, in this one, you can, if you can talk about it, I don't know, because I don't know, like, doctor-patient, what is it called? Doctor-patient...
relationship confidentiality.
Confidentiality, right? Like, just from your own medical perspective, like, what stood out, like, in my own case? Because even for now, I know I'm better, definitely, but I would want to know, like, probably, like, what stood out or, like, what really was my big issue.
First thing I like the most, which stood out most, is you're happy to talk about it in front of camera. Definitely. You have not shied away.
Definitely.
And you're encouraging people not to shy and seek help as soon as possible so that you can have better quality of your life. So that's the most important thing for me. Which I like the most.
Appreciate that. Okay, now, and just like now for my personal procedure, like I know I thought I had fissure, but also like in your notes it said like there were hemorrhoid findings, right? So is it possible, like maybe just to explain to that again, because there are so many people, it's crazy because after I was just doing my post-care, people are trying to visit me, and just like usual, friends pass by. I'm like, no, this is not the perfect time because I'm healing. I just had surgery. And then once I start describing what one person knows somebody who's going through something similar, and so on and so forth. But like from my personal procedure, like what exactly was going on with my situation?
Now, see, that's what I told you. First thing, when you have a fissure, because of your pain, your anus is tight. I mean, you tighten your muscles out of your pain. So I can't see deep enough before surgery. So all we see is a fissure, and that was the major problem. So we scheduled you surgery for a fissure. During the surgery, under anesthesia, I can see things better inside. So we found some hemorrhoids. But as I just told you, not all the hemorrhoids need surgery. It was not giving you any bleeding.
Okay.
So unless it gives you a problem, you don't need to touch it. And you don't do unnecessary procedures. So you only treat what's giving you problem right now. If it's something which in long run can be harmful, like it can turn into cancer, we need to take care of it. But these things don't turn into those things. And it can be managed with diet and lifestyle. And you are very much positive about making changes in your diet and lifestyle. So we don't need to touch it. So that's why we just mention it, that it is there. But it doesn't need to be done right now.
But that's not like nothing major that's affecting me.
What was affecting is a fissure. So we take care of it that time.
Okay, and then now like another thing, because I can say now that I think about it, this is probably something that has been on and off. If I was to think like an accurate number of just duration of months, years, I can say probably maybe 8 years.
8 years, that's a long time.
Yes, but now again, there's a fear of talking about it, like, and not understanding exactly what's going on and not knowing who to go and talk to. Or even if you go to hospital, I think like it's not easy if you're going to a specialist where you know exactly what's going on with you.
That's true.
So like from your perspective, how do you think my procedure went?
It went pretty smooth. Like by the time you came, you were very much predetermined that you want a permanent solution because you had suffered for a very long
time.
So it didn't took a lot of effort to explain you the requirement of surgery. You were well prepared. During surgery also, you were very positive. So it helps us a lot. Usually you see when a patient is anxious, it also creates some difficulties. But you were well prepared, not very anxious. You were a bit positive. So that's what I liked a lot. I mean, and that's what I want to tell all the patients, that if you stay positive, that trust in your caregiver, trust your doctor, trust your nurses, be positive and think about positive outcomes. It definitely helps. Okay, it's kind of like a law of attraction, that if you think about negative things a lot, you may get some of them.
That's true.
That's why it's not like that if you think about positive things only, still you can get some negative things sometime.
True.
But that doesn't mean that you need to stay negative. Always try to stay positive. We are always well prepared. If anything goes wrong, we are trained to manage it as well. And we always explain all the things, possible complications before surgery. And that is done to relieve your stress rather than increasing your stress.
True, very true.
So the positive attitude is very important.
Okay, like what advice do you have for patients, probably like me or other people who are just navigating post-surgery healing?
Post-surgery healing, being ambulatory is the most important. Try to be as normal as possible.
Okay.
Don't stay in the bed and feel like a patient. Try to feel like a normal person. Get out of bed, walk a bit. I'm not asking to run or go to gym, but move around in your house. Don't have fear of eating the healthy small stuff, because I've seen that people are having fear to going to toilet as well, and that's why they don't even eat. That if I eat, I'll have to go to to toilet. So I've seen that as well. So don't have fear. Try to be as normal as possible. Take your medicines regularly. Follow the diet advices, and it all should be fine.
Okay. I know for my case, I can just say definitely the first week was like the most difficult, but it's just because it's still probably the wound is still fresh, and it's kind of like still in the process of healing. But definitely it gets better by week 2, week 3, week 4. It just like there's a very big improvement, and also like just quality of life definitely changes. And I can't believe like just from like 7 years ago, probably I've been experiencing the same thing, and now it's no longer there. That's just, to me, mind-blowing, because it just shows you like the importance of how modern medicine can actually just change your quality of life, and actually just even save you from like, further pain, discomfort, like in future.
That's good.
Okay, another thing that I have to ask on just fissure recovery. What's the importance of like sit baths routine?
Yeah. Now, sitz baths are helpful even before surgery and even after surgery as well.
Okay.
The basic purpose of sit bath is give you some relaxation in the muscles around your anus. Now, when you have a cut at your anus, due to the natural reflex of to that cut, the muscles around anus goes into spasm. And your anus becomes tight. So it's same with surgery. Although we make a cut in the muscles in that area, but when you do sitz bath, it always relaxes the muscles and soothes the healing process. That's why sitz baths are necessary.
And then I don't know how, maybe you can explain this, because again, to me, it's just like as a patient, again, you know, like I'm quarter way on my notes, but I'm trying to make sure we just end on time and we're almost there. Like, how is it that you're not in control? Because when, let's say you're going for bowel movement or you're going to the toilet, like automatically, like just your anus just locks up on its own. It's not even you. You're trying probably to go, but you find it like just closing up automatically. What's just the major?
Is it before surgery or after you're talking about?
Oh, no. This is before.
Before. Yeah. As I told you, it's the reflex to the cut. When you have a cut, in response to the cut, the muscles goes.
Also, it's just the muscles on their own. They're just tightening.
Now you see, we have two kinds of muscles around your anus: inner muscles, outer muscles. The inner muscles are involuntary muscles. You don't have control over them. Outer muscles are voluntary muscles, so you have control over them. So normally, the inner muscle involuntary can become tight and can relax depending upon when the stool reaches into your rectum. Okay, but when you have that cut, because of those spasms, it doesn't get relaxed. Even if you try to relax your external muscles, that internal muscle is still tight because of the cut.
Oh, man. Okay. And then another thing also, as we're winding up, just because I've noticed, like when I've started talking about like, oh, I got this procedure done, I got this procedure done. Like I've heard like people say, like, I know like people who are there in their early 20s, and then there's a friend of mine who said like they have like a cousin who's probably in primary school, and they're experiencing something similar. Because to me, when they were saying like constipation, I'm just like, okay, does the person fear going to the toilet? Is there pain? Now I start like analyzing as a doctor because I'm like, I think that's exactly what I was going through. But what do you think is the main cause, like even in younger people having something like this? Because I've noticed
partially fast food. It has increased in recent years, and kids eat more fast food. They don't get enough of fibers out of these fast foods. Another thing is children are very playful. They'll play a lot and forget to drink their water. So because of that, they go out playing. They totally forget they need to drink their water, and those are the factors which affect the kids.
And at this point, I think like even if I was to have a kid, like they have to drink water, whether they like it or not. It's just some of the things that you have to like just create a certain lifestyle and make sure people just. And I think even from everything that we've talked about, it all narrows down to lifestyle and diet. So is it that just interesting because all this can be avoided by lifestyle choice and diet?
Exactly.
And now, because I know I will not hold you hostage because I said 1 hour. I'll try and make sure I be respectful with your time as well.
Thank you.
Now, just for the purpose of the podcast, like if people wanted like just more information on how they can reach out to you, because I'll tell you personally how I contacted, Google. How I got you. Not even Google.
Then?
ChatGPT.
Oh. ChatGPT, I was not aware about it.
Yes, that's how I found you, and that's how I've been just like finding like the most suitable post-care things and everything, and it's crazy. But like, just for personal information, if people needed to reach out to you with questions and everything.
I am on a Google page, so you can always message me via Google. So I can give you appropriate timing that when you can come see me or if you have any doubts. Because being a surgeon, Sometimes I'm in surgery, so just walking in could be difficult if I'm doing a surgery at that moment.
Yeah.
So to save time, you can find me out on Google, send a message, and then I can give you the appropriate time to see.
Okay. And then another question also. We are summarizing. Definitely, we're still at the 1 hour mark.
Yeah.
Like social media content wise, because like even when I found you through
Yeah.
ChatGPT, I was just looking you up like on social media stuff, because there's Facebook. There's an Instagram page as well.
Yes.
But do you have any plans on like maybe doing more content to be more informative to people and everything?
I want to do more content on Instagram, but not finding enough time to do that. I'm not so great with that social media technology stuff, creating posts.
Yeah.
But yeah, I would like to improve on that thing. I mean, nobody's perfect. I have still room to improve in that area.
Yeah, because I think you're very good at what you do. In fact, and I had said this in my mind, just after I got the procedure done and I checked out your social media. I'm very good with production and all those things. And in my head, I had already said, like, if he does this procedure rightfully for me, what I'll do in return is like, I will give you one free video every month for 12 months, completely free. I mean, I'm not charging you for anything. As you can see, I'm a whole working production house. But for 12 months, I'll give you like one video for absolutely free for social media for 12 months, just because you've given me a different quality of life.
Thank you so much.
So definitely we'll just exchange notes on that. But also like one more, I know I keep saying one more. How many procedures can you say probably you've done over the years? Because I know you've done this for a very long time. Do you keep count?
Yeah, I do keep count of it. So it's somewhere near 3,000, because I've been working for procedures. I've been working for 11 years, so it's somewhere near there.
3,000 procedures. Yeah. I respect that.
Thank you.
And then another thing, this is very important, and it might sound silly. Like people who work with their hands. Yeah. We have like professional boxers. Yeah. They do insure their hands.
I have not done that.
I'm just saying. So I'm just asking, but is that something that, in such a career, is it common for people to actually like insure their hands?
No, unfortunately, it's very uncommon.
Really?
People don't do that.
Wow. Okay. I mean, I don't have any other questions to ask. Anything else I think can come like, in a part 2 video. But definitely, thank you very much for just taking time out of your busy schedule to come and do the podcast. And I also hope this has been informative to people. And if you have any questions, don't ask me, because I'm not the expert. I might not give you the best answers. But maybe from my procedure, I can maybe share some notes here and there. But definitely just feel free to reach out to the doctor, Google information. And if there are any social media contact details that you'd want me to include in the podcast, I can definitely put them like maybe in a description or a link.
Just my name is sufficient for the Google profile.
Okay,
Dr.
definitely.
Dhaval R Mistry.
Okay, perfect. So till next time, guys, we have to say goodbye for now. And if you're to have one advice for people out there watching on ways that they can avoid being in a surgical table. Of course, that's business too. I'm not taking business away from you, but like, how they can just improve on their life to make sure they don't get into certain situations. Because you have the first-hand experience on how people can.
So make healthy choices and stay consistent on it.
Healthy choices and consistency.
Yes.
Okay, apart from that, guys, we have to say goodbye for now. See you in part 2 maybe.
Bye-bye.
Bye-bye. The Kisscapades podcast is your gateway to holistic growth and personal transformation. Together we'll unlock the secrets to living a life of health, wealth, love, and happiness. So make sure to tune in every week and join us as we explore the essence of what it means to truly thrive. And lastly, show us some love and support in our social media platforms from Facebook, Instagram, YouTube, Spotify, Apple Podcasts, Google Podcasts, basically all the social media platforms that support podcasting will definitely be there. Even with the short clips and reels, you can find us there. And lastly, don't be shy with feedback, suggestions, or any questions that you might have in regards to the episodes or our podcast. It's the Kisscapades Podcast. Goodbye.